urine concentration can vary depending on hydration levels in the body. So therefore, you're trying to make sure that if you don't have enough fluid in your body, you're not excreting extra fluid. You want to conserve it. But if you're fully hydrated, drinking fluids, you got plenty of intake, then you can let more fluid be released, which means you need to control the concentration of urine dependent on hydration levels in the body. The kidneys do this by setting up an osmotic gradient. You can notice that up in the cortex, you're looking at about 300 milliosmoles. But moving on down into the medulla, you can reach levels of 1,200 milliosmoles. What this allows for is allows your body to either release dilute urine or to concentrate the urine to make sure it's more concentrated urine leaving the system. So this is what's referred to as the countercurrent mechanism. Now the countercurrent mechanism is going to set up this gradient via the loop of Henle as well as the vasa recta. They work together to create this osmotic gradient the deeper you go in the medulla. What ends up happening is the kidneys can vary the urine concentration anywhere from 300 milliosmoles all the way up to 1,200 milliosmoles as necessary. Now, you don't want to be at that 1,200 milliosmol level because you know you're dehydrated at that point. And a very simple way of looking at this is, what's the color of the urine? The closer to pure water, that's more dilute. The deeper and darker the yellow, the more concentrated it is. So this countercurrent mechanism has three main pieces that play a part. First off, those long, deep loops of Henle that are part of the juxtamedullary nephrons, those will play a part in setting up this gradient. I already mentioned the vasa recta are also here. So you have these loops of Henle being the countercurrent multipliers and the vasa recta being the countercurrent exchangers. The idea is they're going to help working together to create that gradient. And then the collecting ducts, they then will use that preset gradient to determine what the concentration needs to be at before excretion. So all three are working together, the actual loops of Henle and the vasa recta to set up the gradient. The collecting ducts then will adjust the urine based on what's necessary. All right, so here we have a nice blown up view of the loop of Henle. As you're heading down and then heading back up here, give an idea here. As you're heading on down, you'll notice that the water is leaving. All this water is heading out. As you're losing water and gaining urea for that matter, you're concentrating the filtrates. But then if you go back up the other side, notice it's all salt is being pulled out. Sodium chloride is leaving. The water is being kept inside. That means as the salt is pulled out, that concentrated filtrates start to dilute and dilute and dilute. The idea is you're starting with a more dilute filtrate and you're ending with potentially an even more dilute filtrate. So even though you concentrated, you then undid the concentration to dilute it. That's because when all the filtrate is going through these loops of Henle, it doesn't always need to be concentrated. This is just setting up the gradient. The loop of Henle is not creating concentrated urine. The collecting ducts are what will create that urine. So the loop of Henle is just setting up the gradient in these juxtamedullary nephrons. But it works with the vasa recta. Remember, the vasa recta are the capillaries around the loops of Henle of the juxtamedullary nephrons. So they're maintaining the osmotic gradient. You want to maintain it from 300 milliosmoles down to 1,200 milliosmoles. And it's helping to deliver blood into that medullary tissue to do this. But really the main thing is protecting that gradient, maintaining it, keeping that gradient present, because it's reabsorbing H2O. So all that water that's being pulled out of the loop of Henle is going and being reabsorbed back into the vasa recta. So that way, as you pull this fluid out, it's not just sitting around, it's not diluting the area. You're constantly removing it and getting it out of that area. So it kind of looks like this. You notice the vasa recta, we have blood from the arterial and heading out to the vein. So we're flowing from the left here up to the right then. So kind of going down and back up. But what you're noticing, what is going in as if happening here? So as we're doing this initial part, salt is going in. It's concentrating the blood flow going down. That means as this vasa recta gets deeper and deeper and deeper in medulla, because of all this salt it's picking up, it's creating a more concentrated solution in the blood. But then as it starts to move back up, heading back towards the cortex, notice it's now picking up water and dropping off some salt. So that picking up the water is diluting it as it goes back up. That means we're maintaining that gradient from the very high 1200 milliosmoles at the base, all the way up to the top, we're just floating around that 1 to 300 milliosmol range for the filtrate. So the vasa recta serves a similar purpose. It's picking up the water that's left out of the filtrate and then picking up the salt. So by dealing with this in a countercurrent mechanism, so think about it, as the water is being pulled out, the water is being picked up by the vasa recta going up. It's picking up water as the actual loop of Henle goes down and releases water. So it's making sure that's not sitting around, it's not staying in that area. It's going in the opposite flow, thanks countercurrent aspects there. And then finally, once that gradient is set, then the collecting ducts can do their job. So we have the whole gradient set up now. The collecting ducts can choose to pull water out and concentrate on the way down, or not pull water out. So here is the formation of dilute urine. We're still going through the same thing in the loop of Henle. Concentrate, 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 but then dilute on the way back up. And it stays dilute because the entire collecting duct didn't really need to pull water out. This system was hydrated. There was no need to conserve extra water. But you can notice that down here, we do have urea being pulled out. That urea is pulled out and put into the loop of Henle. So it kind of reuses it and recycles it a little bit. So that's the dilute urine when there is no ADH or very minimal ADH present. Remember, ADH, antidiuretic hormone. So it depends on if that's present or not, controlling the amount of fluid. So if you don't have ADH, you're not really trying to conserve fluid. You're hydrated enough. Mention the urea was already pulled back. That's urea recycling. It's basically going back into the loop of Henle, going back and forth. Collecting duct, loop of Henle. Goes back to the collecting duct, loop of Henle. So it keeps this kind of recycling process going off. But that was the dilute urine. Look at the concentrated urine. Now we have ADH here. Tons of ADH is present. We still have the exact same thing occurring in the loop of Henle. Nothing changed there. It concentrates on the way down, dilutes on the way back up. This portion in the loop of Henle is exactly the same for dilute urine or concentrated urine. They don't change. The difference is over here in the collecting duct. Remember, in dilute urine, the collecting duct didn't need to reclaim any water. But look here now, we have ADH. That means we have to conserve water. Look at all the water being pulled out. All that water is being pulled out, which means you're concentrating the filtrate as it goes down the collecting duct and the collecting tube. So this is trying to conserve and keep as much water in your system as possible by concentrating the urine. Now, at varying levels of ADH between none and maximum, you'll have varying levels of concentration. Maybe you only concentrate up to 300, maybe concentrate up to 600, maybe 900. But you can control the amount of concentration based on the amount of ADH present, antidiuretic hormone. So a little about how urine is formed from dilute to concentrated urine.